Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello again. Always a pleasure to see you.
Thank you, Doctor. I'm feeling a bit anxious, though.
I understand. Having gone through your recent tests and reports, it suggests that you might benefit from an angioplasty. It's a way to open up the narrowed blood vessels and improve blood flow to your heart. How does that sound?
I've heard of it, but not in detail. Could you walk me through the procedure?
Of course. Firstly, on the day of the procedure, you'll come to our cardiovascular suite. We'll ensure you're comfortable and administer a sedative so you're relaxed but awake. We'll numb a small area, typically in your wrist or groin, where a catheter will be inserted. Through this catheter, a tiny balloon will be threaded to the site of the blockage. Once there, the balloon is inflated to push the plaque against the artery walls, opening up the blood vessel and restoring flow. In many cases, we'll also place a stent, which acts as a scaffold to keep the artery open.
Sounds a bit overwhelming. Is it safe?
It's a common and safe procedure. There are risks associated with any medical procedure, but we have an experienced team and use advanced technology to minimize those risks.
How long will I need to stay in the hospital afterward?
Usually, patients stay overnight for monitoring. If everything is stable, you can head home the next day.
And what about my activities once I'm home? Any restrictions?
Initially, you'll want to take it easy. No heavy lifting or strenuous activities for a few days. Gradually, you can resume your normal activities under our guidance.
Will I need to take any medications afterward?
Yes. To help keep the artery open, you'll likely be on blood thinners for a period of time, and we'll discuss that in detail.
My friend mentioned something about a cardiac rehab program. Is that necessary?
Cardiac rehab can be beneficial for many patients after angioplasty. It provides structured exercise, education, and support, helping you return to a healthy lifestyle.
That sounds promising. One last thing. I love dancing. Can I continue with it?
Absolutely. Dancing is a great form of exercise. Once you're fully recovered and with the green light from us, you can definitely dance your heart out.
That's reassuring. Thank you, Doctor. I trust you and the team. Let's move forward with the procedure.
Great decision. We'll ensure you're taken care of throughout the process.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon.
Hello, are you Dr. Stevens?
Yes, that's me. And you are Mrs. O'Connor?
Yes, that's right. It's good to meet you.
What can I help you with today?
I've been experiencing a lot of lower back pain lately.
I'm sorry to hear that. How long has this been going on?
About a month now. It started gradually, but has gotten much worse in the last week.
Were there any incidents or activities that you believe might have caused it?
I recently started doing more gardening, and I guess I might have lifted something too heavy.
That can certainly contribute. Do you feel pain radiating to your legs or any numbness?
A bit, yes, mainly to my right leg. Sometimes there's a tingling sensation too.
Got it. Any other symptoms or conditions you think I should know about?
Well, I've had some occasional headaches, but I'm not sure if they're related.
It might be. We'll look into it. Do you currently take any medications or have a history of back problems?
No medications, but my mother had some disc issues in her back.
Genetics can sometimes play a part. I suggest we get an X-ray and possibly an MRI to understand the root cause. In the meantime, I'd advise against heavy lifting.
That sounds sensible. Should I also stop gardening for the time being?
It would be a good idea, at least until we pinpoint the issue. It's better to be cautious.
All right. Anything else I can do for relief?
I'll prescribe a mild pain reliever and also recommend some physiotherapy exercises. It will be beneficial if you can see a physiotherapist.
Sounds good. And how about sitting for long periods? I have a desk job.
Try to take short breaks every hour. Walk around for a bit. Prolonged sitting can exacerbate the pain.
Thank you, Dr. Stevens. I appreciate your advice.
It's my pleasure. Let's schedule a follow-up after your tests.
Perfect. See you soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
An echocardiogram, often referred to simply as an echo, is an ultrasound of the heart. It uses high-frequency sound waves to create detailed images of the heart structures and to assess its function. During this procedure, a device called a transducer is placed on the chest, which emits sound waves that bounce off the heart and return as echoes. These echoes are then converted into moving images displayed on a monitor. The echocardiogram provides information about the heart's size, shape, and how well the heart chambers and valves are functioning. It can also detect potential issues like fluid buildup around the heart or abnormalities in the heart's walls. Before the procedure, you might be asked to wear a hospital gown and lie down on an examination table. There's no specific preparation needed, but it's always good to wear comfortable clothing. If you're pregnant, breastfeeding, or have any specific medical conditions, please notify your doctor. Rest assured, the echocardiogram is non-invasive and doesn't use radiation. It's a safe procedure offering invaluable insight into the health of your heart.
Now look at question 26.
It's fascinating how much the landscape of pediatric vaccinations has evolved in just the last decade. Remember when we relied on multiple shots for full immunization?
Absolutely. Now, there's an increasing trend towards combination vaccines, which means fewer injections for the child. It's not just about convenience, but also improving adherence rates.
Exactly. Plus, the recent research on adjuvants is promising. We're seeing enhanced immune responses in children, especially for traditionally hard-to-immunize groups.
And speaking of research, have you come across the developments on the nasal spray vaccines? It's a game changer, especially for children who have an intense fear of needles.
Yes, it's all part of making the immunization process as child-friendly as possible. The sooner we can incorporate these into regular schedules, the better the overall public health implications.
Now look at question 27.
In a dietary consultation, the main goal is to assess and understand an individual's nutritional needs and habits. Typically, the meeting starts with the nutritionist getting a comprehensive dietary history, including any allergies, food preferences, and medical conditions that might affect dietary choices. We'll also delve into lifestyle factors like exercise habits, stress levels, and sleep patterns. Based on this information, we'll work together to develop a personalized nutritional plan. This could involve suggesting certain foods to incorporate, foods to avoid, or potentially recommending vitamin or mineral supplements. We'll discuss ways to achieve and maintain a balanced diet, and I'll provide resources such as meal plans, recipes, and grocery lists. Remember, it's not about drastic changes overnight, but making sustainable, healthy changes step by step. If you're on any medications, please bring a list, as certain foods or supplements can interact with them. The session is also a space for you to voice any concerns or questions about nutrition, weight management, or related issues. By the end of our meeting, the aim is to empower you with knowledge and a strategy to make informed food choices that align with your health and wellness goals.
Now look at question 28.
There's been a significant push lately for integrating mental health screenings into primary care, and rightfully so.
Indeed, it's alarming how many mental health conditions go undiagnosed or untreated simply because they don't present in traditional settings. A routine checkup can be an opportune moment.
And the ripple effects of early detection can't be overstated. From the individual's quality of life to broader societal benefits, it makes a difference.
Not to mention the cost savings. Early intervention can prevent hospitalizations, reduce medication needs, and improve overall well-being. It's a holistic approach.
Absolutely. Our primary care setting is the front line. We need the right tools, training, and support to ensure we're addressing both physical and mental health. The two are inextricably linked.
Now look at question 29.
Have you read the recent publication on the correlation between sleep duration and immune system strength?
Yes, I was quite surprised by the findings. The study demonstrated that people who consistently get less than 6 hours of sleep are more susceptible to infections, aren't they?
Exactly. I always knew sleep was essential, but I didn't realize just how significant its role was in immunity.
It's a wake-up call, no pun intended, for many of us in the medical field given our irregular sleep schedules.
True, especially during these long shifts, but it's also crucial information to share with our patients, especially those recovering or with compromised immunity.
Absolutely. I'm considering recommending the study to the hospital's patient education team. It might make a difference in patient recovery and overall well-being.
Now look at question 30.
I've been going over the proposal for the new EHR system. What are your thoughts?
It looks promising in terms of features and user-friendliness, but I'm concerned about its interoperability with our current systems.
You've nailed it. Transitioning to a new system can't be disruptive to patient care or our daily operations. We need seamless integration.
And training is another big factor. The staff needs to be well-trained, comfortable, and confident with the change. How well does the company support that?
They claim to have an extensive training and support module, but I believe we need to dig deeper and perhaps ask for reviews from other hospitals that have made the switch.
Agreed. An EHR transition is massive. We need to ensure we're making the right decision for the long term.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
In today's discussion, we'll be addressing the issue of digital health fatigue, a term which has become increasingly prevalent in today's tech-driven healthcare landscape. The exponential growth in health applications and wearable tech has led to concerns about whether we're drowning in data without necessarily benefiting from it. Could you introduce us to this concept and how you first became interested in it?
Of course. The conversation around digital health fatigue started to gain momentum after the 4th annual Global Digital Health Conference. Everyone was raving about the next big health app or wearable tech. There was this unified sense that we were on the brink of a health tech revolution. However, by the 5th day, an invitation-only expert session was conducted to discuss the implications of this data deluge. Surprisingly, or maybe not so much, we realized that while there was a lot of excitement, there was also a growing concern. Despite having more data than ever before, there was a question of its actual utility. Many felt overwhelmed by the constant monitoring, notifications, and health reminders, questioning if it was helping or hindering their health journey.
Why is it so essential to address this digital fatigue? What problems arise if we don't?
Well, the promise of digital health is to empower individuals to take control of their health. However, if people feel overwhelmed or anxious because of constant monitoring, we might be moving away from empowerment to creating unnecessary stress. Moreover, not everything that can be measured should be measured. With more data, there's also a risk of misinterpretation. For patients, it might lead to unwarranted anxiety, and for healthcare professionals, it can result in making decisions based on redundant or irrelevant data.
This sounds a lot like the balance we need to strike between quantity and quality. Can you elaborate more on this dichotomy?
Exactly. With the explosion of digital health tools, we're definitely in an age of quantity. There's a tracker for almost everything. But the question we need to ask is this data meaningful? In the initial excitement of having so much information at our fingertips, the quality of this information may have taken a back seat. Just because we can track something doesn't mean we should. And if we do, we need to ensure that the data is presented in a way that's easy to understand and actionable for both the patient and the healthcare provider.
Your recent article highlighted several themes regarding digital health fatigue. Could you share a few of those with our readers?
Certainly. Firstly, there's notification fatigue, where individuals are bombarded with reminders and alerts. This can lead to them ignoring critical health alerts. Then, there's the paralysis by analysis phenomenon. With so much data available, some individuals don't know where to start or how to interpret the information, leading to inaction. Another theme was the illusion of control. Just because you're tracking doesn't mean you're improving. It's the actions we take based on that data that count. Lastly, there's a growing concern about privacy. As more and more health data is generated, ensuring its security becomes paramount.
So, the challenge ahead is to refine the digital health experience, ensuring that it adds genuine value rather than just adding noise. Would that be an accurate summary?
Precisely. The future of digital health should be guided by meaningful insights and actionable data, ensuring a balance between tech-driven insights and human touch.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Alzheimer's disease, a devastating neurodegenerative disorder, has been known traditionally as one singular ailment affecting our elderly. But a groundbreaking new study suggests that it might be 5 different types based on one's genetic blueprint. Our health correspondent, Dr. Jackson, joins us to unpack these findings. Dr. Jackson, 5 distinct types of Alzheimer's disease?
Yes. It's fascinating. The progress we've been witnessing in genetic research is shedding light on many previously uncharted territories. This recent study underscores the revolution that new genomic techniques are bringing to our understanding of disorders like Alzheimer's. It's a giant leap towards personalized therapeutic strategies. As of today, the severity of Alzheimer's has been primarily determined based on cognitive assessments and certain brain scans. But this revolutionary research has analyzed the genetic patterns of over 1,500 patients across the globe, suggesting that Alzheimer's, while perceived as one entity, can be segregated into 5 distinct genetic categories.
So, in layman's terms, depending on one's genetic type, they might experience Alzheimer's differently and respond uniquely to treatments.
Precisely. For instance, one subtype they identified may progress much slower and might respond exceptionally well to a particular kind of therapy, while another might be aggressive and require an entirely different treatment approach. Another subtype appears to have a strong link with inflammation processes in the brain, which means new potential targets for drug development. What's crucial here is that this categorization can aid in precise treatment modalities, ensuring patients receive the most effective interventions tailored to their genetic subtype.
This sounds like a potential game changer. So what does it mean for diagnostic methods, treatment outcomes, and overall patient care?
Well, it implies a comprehensive shift in our approach. Diagnostic tools may need updating or even developing anew to differentiate between these subtypes accurately. It also highlights the imperative need for more diversified and targeted therapeutic strategies. For instance, a patient with a slower progressing subtype may not need as aggressive a treatment as another with a rapid progressing type. This could spare many from side effects of unnecessary treatments. But remember, while this revelation is monumental, translating these findings into practical, clinical outcomes will take time. Clinical trials, validation, and then integration into everyday healthcare practices are steps ahead.
That's enlightening. Any concluding remarks on the way forward?
We're standing at the brink of a paradigm shift in treating Alzheimer's. These findings are not just academic. They have the potential to change lives. Research bodies globally are gearing up to fund further studies, and hopefully soon we'll be moving from one-size-fits-all treatments to highly individualized care for Alzheimer's patients.